Okay, great. Thank you for coming along today, everybody. Welcome to Health HQ. This is an online showcase of our Faculty of Health and Medical Science degree offerings for 2023. Thanks for joining us for tonight's webinar regarding the Bachelor of Dental Surgery program. My name's Matt, and I'm a Future Student Advisor with the Future Students team here at the university. Now, just to begin, I'd like to start off the presentation by acknowledging and paying respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country. We respect and value their past, present, and ongoing connection to the land and the cultural beliefs. Now, to get started, I'd like to introduce our panel, just starting with our Program Coordinator, Associate Professor Dimitra Lekas.
Hi, everyone.
Thank you. We also have with us Senior Lecturer Dr. Eleanor Parker.
Hi, welcome.
We also have three third-year BDS students. We have Prithika.
Hi, everyone.
We also have Samantha.
Hello.
And we also have Sharon with us today.
Hello.
Thank you. I'll now hand over to Dimitra to present some information about the dental surgery program.
Thanks, Matt. So the Adelaide Dental School is the #1 ranked dental school in Australia and is the only Australian dental school in the top world 50. Our school also recently celebrated its centenary. So we do have a very proud history, and both myself and Eleanor are also past graduates of the Adelaide Dental School. Next slide, please. So as you saw in the video, the Adelaide Dental School has several world-class facilities, and one that's also an image on your screen is the Adelaide Dental Simulation Clinic. So our simulation clinic has 90 individual dental simulators, 2 dental surgeries, a clinical dental education unit, and a really interesting piece of equipment called the artificial tooth vending machine. Our dental school also comprises of the Adelaide Dental Hospital, which is an 89-chair dental hospital offering both general dental services and specialist dental services to the public. Next slide, please. So some of the unique features of the Adelaide Bachelor Dental Surgery program include our students treating real-life patients in the Adelaide Dental Hospital. We have extensive clinical placements across multiple sites in Australia, and we also our students have a major impact on improving the oral health and well-being of members of the community, including also participating in our community outreach program, which I'll talk about a little bit later. Next slide, please.
Dentistry at the University of Adelaide is a 5-year undergraduate degree, and when you complete the training, you'll be a qualified dentist in Australia. A lot of our lectures and our tutorials are here in the HMS, and it's really convenient for us because it also happens to be where the Adelaide Dental Hospital is. That is where we spend a lot of our time learning our clinical skills. And then the sim clinic, you're mainly focusing on learning how to do fillings, so drilling teeth, and also learning how to do root canal treatment. This gives an opportunity for students to learn all the practical components of dentistry, but not on real people. You practice on plastic teeth, but you also practice on extracted teeth.
I think work in rural clinics is the most inspiring thing I've done in this degree. Getting to work with some of the patients that have such unique backstories and show real appreciation for the work you do really makes me feel like this was the right career choice. This degree can lead to many different career paths other than just being a dentist. There's opportunity for specialisation. You can also go into research, and there's always the opportunity for oral health promotion in communities, which is extremely valuable. I feel at the end of this year ready to step out and start working on my own and being a professional.
So our Bachelor Dental Surgery program is a 5-year full-time program, and it's the University of Adelaide is the only university in South Australia to offer a dental degree. Our first years begin in February, so we have a February intake. And as we've seen in both the videos, our students do spend a lot of time in the dental simulation clinic. So they spend time across all the year levels, and here they learn how to practice in a sort of a simulated dental clinic setting where they practice applying their theory to practical skills before they move on to real patients. Another unique feature of our program that runs across most of the year levels of our program is our students also work in small teams and work through what we call real life case-based scenarios. And here they learn to begin to think and act like dentists. They work in small teams, so they learn how to communicate with each other in a small group setting. They also start to develop their research skills and sort of apply those back to real patient scenarios. As we've mentioned before, we have extensive clinical placements. Our students in the first 2 years work on each other, and then in the second half of second year, our students will actually have their first patients, which are usually family and friend patients, we call them, so that people that are sort of close to their own age group, and provide some very simple basic preventive care. And then once they reach third year, our students will then start working on members of the public. And then by the time they reach final year, they'll have a sort of a long extended academic year where they're on clinical placement, and they could have opportunities working in both the Adelaide Dental Hospital, metropolitan clinics, rural placement, or interstate placement. And also a very special feature of our Adelaide Dental Surgery program is our community outreach program. So this is a program that's offered to our final year students, and in our Common Ground clinic, we see members of the public that are most disadvantaged, and our students are able to provide them care that they need to make a huge, and that all our students make a huge impact on the oral health of the community. Next slide. So in this slide here, we've just got an overview of some of the key features of our program. So the Adelaide Dental Surgery program is actually has only one subject in each year level, and it's what we call a fully integrated subject, and it runs from semester 1 into semester 2. And we integrate the biological sciences, the dental clinical sciences with the clinical practice. So this is a very unique feature of the Adelaide Dental program, and one that both myself and Eleanor teach in both the first 3 years, or 4 years of the program. And you know, we have spent lots of time with our students, and we can really see the benefits of this sort of integration between theory and clinical practice. As I mentioned before, our students start to do small group case-based dental scenario learning and work in small teams. They actually learn how to work with each other. They work in threes in the clinic in first year. They learn how to take the role of the dentist, the dental patient themselves, and also the dental assistant. So we introduce them to the dental team, and we also have lots of class sessions with the Bachelor of Oral Health students. So the students learn how to work together both with other members of the dental team. And then in second year, we sort of continue building on their skills. They spend a lot of time in the dental simulation clinic in second year, as well as clinical practice. And so they learn more about dental diseases and risk assessment and monitoring patients' oral health through minor ailments. Then when we get to third and fourth year, our students, in terms of the clinical and biological sciences, sort of learn lots more of the complex dental disciplines. and have a more deeper understanding of dental diseases and diseases that affect the humans, like human diseases. They now start to do lots more, so they apply the skills that they learned in the simulation clinic in first and second year, in third year. So they actually start to provide, real life clinical procedures. They supervise closely, and that's another unique feature of our program. Our students are in small groups in the clinic, supervised by qualified clinicians, and they help them to apply their skills and knowledge. They've developed the skills of, comprehensive, holistic clinical patient management. And so then by the time they get to final year, our students can, work through the full range of skills and knowledge required by a general dentist before they graduate. So this includes preventive care, restorative care, root canal treatment, prosthodontic treatment, which includes making dentures, crown and bridge work, as well as pediatric dentistry. We cover pediatric dentistry in fourth year, and simple extractions or simple exodontia. Our students also learn about how to manage patients with special needs and geriatric dentistry as well. So yes, you can see that we scaffold our students and we start them off with, sort of very simple preventive care and building them up to be able to provide the full scope of practice for a general dentist. We expect our students to sort of integrate the theory with clinical practice. And I think, by the way, our curriculum is structured that we enable our students to do this. Another really key feature of our program too is self-reflection and monitoring of our performance. And this is a key quality that our students need upon graduation, becoming self-reflective practitioners. Our program also features students understanding about evidence-based dentistry, research skills, as well as health promotion and Indigenous oral health care. Next slide, please. So as was mentioned also by some of our graduates in the video, once you finish from your 5-year degree, our graduates can work in a variety of settings. Private practice is a common one. Certainly, graduates work in public practice, so either in sort of community or school-based dental clinics. You can become academics like Eleanor and I. So we both started off, working in practice and then having a career change to academia. Become a researcher, in dental research, oral health research, epidemiology, sort of making an impact on, the public's sort of public oral health care, as well as specialty dental practice. So the Adelaide Dental School does offer also a range of specialty dental programs as well. So it's a very flexible career. You can work full-time and part-time. And our program provides you all the knowledge and skills to, graduate to full independent, to sort of practice where you can graduate. There's no internship year once you graduate, so you can work immediately. Usually our graduates, work with mentors in small practices or in public practices where they have a mentor, work in teams and, work with a sort of full range of the dental team members as well. Next slide, please. So in the next set of slides, we're just going to just provide an overview of our admissions information. So in this slide here, we've just got some details about application for both domestic and international students in terms of academic sort of requirements in terms of scores for either ATAR, as well as the IELTS requirements for our international students. And we also have a range of prerequisite subjects, such as choosing from chemistry, maths or physics, or from biology, chemistry, geology or physics. Next slide, please. In terms of the domestic application process, you can see here we've just got a very basic flowchart. Our applicants need to have the prerequisite subjects. They'll need to have the threshold academic score. All our applicants need to apply for UCAT, so they'll need to register for UCAT, sit the UCAT test, then apply through SATAC, and then after completing the first 5 steps, applicants are then advised if they're eligible for an admissions interview. The successful applicants will then have their interview, and then offers are made to the successful applicants. And then the next slide, please. And in terms of our international application process, Again, there's the range of prerequisite subjects, moving on to ensuring that you have the academic score, meeting the English requirements, registering for UCAT, setting the UCAT test, and then after completing this first 6 steps, again, applicants who are eligible for the interview will be advised. The eligible applicants will sit the interview, and then offers are made. So next slide, please.
Okay, so thanks very much for the presentation there, Dimitra. It's now time for some audience questions. Excuse me. So if you do have any questions you'd like to run by the students we have present here and the teaching academics and the other staff members here, please put your questions into the Q&A feature at the bottom of the screen, and we'll be able to get back to you shortly. So we do have a question here. Can you transfer into this degree via GPA as part of your university studies? Dimitra, would you like to assist with that one?
So all our applicants, whether they are coming straight from school, like school leavers, or tertiary applicants, have to apply through SATAC and complete the same steps. So there is no transfer into the program. Everyone will gain entry into first year of the program. Yeah, and that's because our program is a fully integrated program. We don't have separate individual subjects, and there's no sort of credit status for any prior courses done. However, you know, like with backgrounds in various tertiary backgrounds, that actually can help you, you know, have that underpinning knowledge and skills that will help you sort of have, you know, like a good sort of standing off, you know, to start off the dental degree.
That's right. And to expand on that to some extent, you can apply using your GPA from another program. We just won't, due to this, as you've seen, the very unique structure of the program, we won't provide any credit for prior learning. So you will start in year 1. But you absolutely certainly can use your GPA and any subject prerequisites you've met external to secondary school for admission. That's right. Okay. I've got a question here about the suggested UCAT score. Dimitra, would you like to assist with that one?
I think that might be one that we could sort of maybe reply to that particular unique question. Yeah, so it's based on its ranking. So the number of applicants, there is no sort of score. You know, it's based on the number of applicants that apply, and it's a ranking.
Yeah, we don't have a guaranteed minimum UCAT score in any way for admission, since it is essentially how your UCAT performance ranks against everybody else that's applied for the degree in your applicant year. We'll typically do a fairly significant number of interviews for places in the program. My understanding is for the 2022 academic year, we have 300 domestic and 100 international interviews. And essentially, if your UCAT score based on sections 1 through 4 ranks you in the top 300 domestics or 100 international, then you'll be made an invitation to attend an interview for the program. Okay, just having a look for some additional questions. A question for the student panelists. What are some things that you can do during high school to prepare yourself for life at university? Samantha, would you like to start with that one? And we'll get answers from the other panelists shortly after.
Yeah, so I think with dentistry, it's a lot of a sort of different degree than any other degree. So I think for one thing that I wished I did more things with my hands during high school. So taking up hobbies, kind of anything that would help me kind of develop those skills when I hit university for dentistry. And also, I suppose, just keeping organized in high school, keeping those like academic skills, because when you hit university, you're going to need those skills. And especially in a degree that is as fast paced and as, I guess, challenging as dentistry, if you're not on top of things, you can quickly kind of fall behind, especially in clinics, because you're going to need that underpinning academic knowledge. So I think in high school, best to kind of build good academic skills and just keep those like hand skills in preparation for university.
Great, thank you. Prithika, would you like to add to this in any way?
Yeah, I agree to everything that Samantha said. I'd also like to add on seeking on job shadowing opportunities if it's available. So if you're really interested in dentistry, you could go to just a dentist that you visit often and just ask if you'd like to job shadow for them for a few days to just get to know what dentistry is really like, and how it will be once you graduate as well. So you really know what you are getting yourself into once you graduate. So I think job shadowing would be a really good opportunity as well. Yeah.
Thank you. Sharon, do you have anything else you'd like to add to that answer from a student perspective?
I think that building on communication skills is pretty important, because like in school, you would do lots of like group work, but then, you know, when you're working in a clinic, you also have to communicate with like the dental assistant and like everyone else who's working, and also your patient. So I think clear communication is important, and also knowing how much to say as well, because like whatever you say can really impact a patient's like outlook. So communication skills are pretty important. Yeah.
Sorry,
Great,
Matt.
thank you.
Sorry, Matt, could I just add in? So just
Of course, yeah.
both Eleanor and I would absolutely agree with all the our three third-year students. So if anyone has the opportunity to shadow, I mean, if shadowing is not possible for various reasons, even talking to, you know, some dentists, finding out about, you know, why they took up the career, what skills and attributes they think make a good dentist. If you can observe them, or even just talk to some, and maybe get a different range of dentists if you can. And exactly like Prithika said, so find out also, you know, what it's like to be a dentist, you know, after graduation. So what it's like to be a dental student, what did they find that being a dental student was, plus the graduation. And clinical communication skills, our program also has a volunteer patient program. So we do teach our students in a simulated environment first, like role playing with volunteer patients, and they learn how to do some of their basic communication skills. Because as Sharon said, you know, having, you know, clinical communication skills is really important. And that all starts from, you know, at high school, maybe doing various activities, extracurricular activities, and maybe working with people from different walks of life or different age groups, in so many things that a lot of, you know, both high school students can participate in, as well as our tertiary applicants as well. And group work, yes, as I think both Sam and Prithika said, our students spend a lot of time working in small groups, in clinic, in simulation clinic, in the case-based scenarios, as well as in larger clinical groups within the clinic itself. So being, you know, effective collaborators, working effectively with teams, problem solving is another important skill. You know, being able to sort of communicate and, you know, problem solve, and being flexible. I think both Ellen and I can attest, we know our three students here, being flexible, adaptable, especially COVID has taught our students about being flexible and adaptable. And I think these skills will set them up for their future careers. Yeah.
Thank you. We have another question here asking a little bit about kind of the graduate study pathways. So could we get some more information about the difference between the Bachelor of Dental Surgery and the honours degree of Bachelor of Science in Dentistry?
Okay. Did you want to
you can do that one too, Jimmy, that's fine. Yep.
Okay, so the Bachelor Dental Surgery program is the 5-year sort of training program to qualify as a general dentist. And so our students are registered, when we graduate, we register with AHPRA in Australia, and we can work in any place in Australia as a general dentist. The honours degree is a program, so after our students complete the first 3 years, because we are a 5-year program, our students can have the option, if they want to, it's mainly for our domestic students, to do what we call an honours degree. So one option is to take a gap year, a year off, and then do a full-time honours program, or to do it concurrently. So we have many of our students who are sort of have to gain a GPA or grade point average of credit standard by the end of 3rd year, and they can enrol in what we call concurrent honours. So you can do your 5-year program, continue in 4th and 5th year, while concurrently at the same time do an honours program. So when you graduate, you'll have both the qualification of Bachelor of Dental Surgery and honours in dental science. Yeah.
Thank you.
Just to add to that, to make sure it's very clear too, that it's in addition to the Bachelor of Dental Surgery. So it's not an alternative qualification. It's in addition to the Bachelor of Dental Surgery, which is your dental qualification. So it's the research component in addition.
Yeah. So the other dental schools might have different sort of terminology for honours program, but ours is, yes, 2 separate qualifications. And some of our graduates and some of our students who are doing it, do it for multiple reasons. They're curious research, like they want to sort of learn more about research itself. A lot of our staff are supervisors, but also some of them think of specialty training later on. And so they use that to also learn some of these skills that they will need in their future career pathways.
Yeah, for those of you that aren't aware, an honours year is typically a research training year designed to give you the kind of research training skills and experience to then go on to do advanced, academic, self-directed or supervised research in your field. Things like honours are typically really useful if you'd like to then go on to undertake further study or pursue a career in academia as well. If you have that academic interest or potentially are looking into something like a Doctor of Clinical Dentistry later on, then this might be something to consider along the way. Now, just another question here. Can students with the Bachelor of Dental Surgery practice in South Asian countries? In response to this, I would highly recommend, due to the way that different countries have different requirements, you can check with your relevant country's dental board to confirm the qualification is accepted. My understanding is that Australian dental qualifications are quite well regarded internationally, but you will have to refer to the individual country board for final clarification, okay? I've got a question here regarding the required ATAR and UCAT score. I think as we mentioned earlier, there is no specific UCAT cutoff. You will be ranked against all other applicants that have applied with a valid UCAT score, and then we will make a certain number of interviews, 300 domestic, 100 international. And if your scores rank you in their top 300 or 100 respectively, we'll make an offered interview. The ATAR minimum is 90, and the GPA equivalent will be a minimum GPA of 5 for consideration. With regards to the number of students in the program, so this information is listed in the admissions guide, but in terms of how many students are chosen each year, my understanding is all students enter via the same sub-quota for standard application procedures. Just double checking those numbers for you now. So we have 36 international places in the program for 2023. And in addition to that, we will have 38 domestic places for the 2023 intake. Okay, another question here. If applying with a tertiary background, will the prerequisite subject requirements need to be met from my degree or back from my year 12 studies? I'm able to help answer that one briefly as well. Your subject prerequisites will never expire. So if you've completed your subject prerequisites in secondary school, and you've done some tertiary study, we're still more than happy to use your secondary school prerequisites, providing you've passed those subjects. At the tertiary level, you can typically complete 2 standard 3-unit university courses to meet any one subject prerequisite. But do have a chat with us in the future students team to help confirm those if you're planning to apply like that. Another question here for these student panelists as well. So what are some tips for starting university? Samantha, would you like to go first again?
Yeah, I think it's definitely what I said before, but I can't stress the importance of just keeping on top of your work. So in high school, obviously the teachers are always kind of spoon feeding you and giving you all the resources you need. But with our degree, because there's just so much to learn, a lot of it, like Dr. Lekas was saying, is research based. So you really need to kind of keep on top of it. You need to go all in and do your work, do your research, and make sure you keep on top of it, because at the end of the day, right now we're in third year and we started seeing patients. What you didn't sort of keep up with in first year and second year will come back to bite you when you come to see patients. And the people who do end up suffering will be your patients. So definitely just keep on top of things, and remember very early on that like everything you're doing is for your patient. So just do your work to the best of your ability.
Great, thank you. Prithika, would you like to add to that?
Yeah, I would say prioritize your time really well. So know what is important and finish that off first. And in regards to lectures and everything, I would say learning objectives is really important. So know during every lecture just know what learning objectives and try to answer them once every lecture is done, so that you know the gist of the lecture as well, and also know how to apply it clinically. So learning it theoretically is really different from applying it clinically as well. But I guess it'll be more useful in year 3 onwards, when you see real patients, and every patient just comes with really different problems as well. So you just need to know how to adapt and just apply whatever you learned theoretically to them as well. Yeah.
Great, thank you. Sharon, do you have anything else you'd like to add to that one?
Yep. So starting from year 1, I think it's important to ensure that you've prepared sufficiently for each lesson. So it can be like clinical or just like a group meeting. And it's also good to be aware of what the expected standard is and how much you have to know, so that you go into a lesson knowing kind of what to expect. And it also helps in your learning. And also, it's not possible to get everything right on the first try. So do allow yourself to make, a few minor mistakes here and there, because that's how you actually improve. But also take note of your mistakes and know how to correct them, so that you can prevent making them in the future. And also, if you're unsure of anything, please do ask your tutors, because they're there to help you as well.
That's great. Thanks very much. A couple of other questions here. Someone's asked about Cambridge A-levels being able to be used for admission. Absolutely, yes. Essentially, we will convert Australian Year 12 equivalent international results to an equivalent ATAR for the purposes of admission, and subject prerequisites can also be met via those pathways. If you do have any questions about your specific high school qualification being able to be used for admission, though, please do get in touch with us at our Future Students team email address. We'll provide that towards the end of the presentation. Now, another question here. What if we don't get into the degree on our first attempt? Are there any pathways? Dimitri, would you like to help with that one? I'm happy to take over if you'd like.
Maybe if you start and then I can sort of add in. Yeah, I think maybe if if your interest is really dentistry and that's your goal, we would suggest some of our other health sciences related degrees here at the University of Adelaide. So maybe, yeah, Matt, if you want to just sort of continue from there, and I can maybe add in. Yeah. Yeah,
of course. It generally, if you are really passionate about a career in dentistry, we would recommend looking into one of our other health-focused options, particularly the Bachelor of Health and Medical Sciences. You cover a range of core courses in anatomy and physiology within this program. You will have the option during your assessment in this program to look into some dental components as well. For reference, I'm one of the demonstrators and tutors in some of the first year anatomy courses. I get quite a few students giving me posters on dental caries, which I learn a lot about passively by reviewing these. But yeah, essentially health and medical sciences would be the preferred pathway in most cases. The good thing about this program is you can apply for transfer to dentistry, to year 1 of dentistry, obviously, just on the basis of your program GPA plus any subject prerequisites plus a new UCAT result. So if you were to apply this year for next year's intake and you were unfortunately unsuccessful given the competitive application process, you could look into starting a degree program. Once you've completed 12 units of study, you get a program GPA, and we can use that program GPA in lieu of your ATAR for admission in the next year's intake. If you have any questions about that process, again, please get in touch with the Future Students team. More than happy to help kind of plan out a pathway with you. Now, another question. What are the key differences between oral health and dental surgery?
Do you want me to take that one? Yeah. So as Dimitri mentioned before, we work as a dental team. So dentists work with dental assistants, and that's probably what you're most familiar with seeing when you go to the dentist, that you see the dentist working with a dental assistant. There's other key members of the dental team though. And so traditionally you might have heard of dental hygienists, and a lot of American sort of Canadian TV shows often talk about people going to the hygienist. So we have hygienists in Australia too, and they're a critical member of the team. The Bachelor of Oral Health, traditionally from where it started, was combining the skills of a dental hygienist with the skills of a dental therapist. So a dental therapist was trained, skilled in managing children. So really providing quite holistic care for children through the school dental service. That role has evolved over the last sort of 10 to 15 years quite significantly. So we have an oral health therapist now that is really quite specific skill set. So specific skill set in managing preventive care for adults and children. Periodontal care. So periodontal care is about gum health. So we're having a key role in the team looking after gum health of both, again, adults and children, and providing restorative care. So restorative care traditionally for children, but also now depending on the qualifications and the experience within different Bachelor of Oral Health degrees, actually providing restorative care in other forms as well. So I guess it's a really significant role within the dental team, but it is a specific skill set. There are some areas of dentistry that the oral health therapist isn't able to provide. So root canal treatment for permanent or adult teeth, for example, or some of the more complex aspects of care are outside the scope of an oral health therapist. So even though some of the work an oral health therapist and a dentist do are very similar, there are areas that are quite distinct. And I guess that sort of fits too when you think about the Bachelor of Dental Surgery is a 5-year degree and Bachelor of Oral Health is a 3-year degree. So a lot of the things that we do in first year and second year and some of the things in third year will actually be combined classes for students in oral health and students in dentistry. But then when we get into the clinic, they may be applied in a different way or a different perhaps complexity of patient. So I think hopefully that has helped explain it. I just did want to highlight too that sometimes people are interested in dentistry and are concerned and think, oh, oral health might be a pathway to dentistry. It's not. People can obviously study oral health and then apply to do dentistry, but we want to be really clear that if you are not going to be happy as an oral health therapist, then you really should think about whether or not going into oral health is for you. So if it's dentistry that you'll really have your heart set on and you're sure that's what you want to do, then as Matt explained, there are other courses that perhaps will be a more appropriate option to do in the hope of then in subsequent years getting into the Bachelor of Dental Surgery. Is there anything else you'd like to add, Jimmy?
And just maybe extending that again, so just like a tertiary applicant, so anyone who's done a previous full degree of Bachelor of Oral Health, there is no transfer to say 4th or 5th year. They would have to apply in the sort of standard pathway and then gain entry into first year. And there are no credit transfer, no credits. It's just, it would provide you the background to it. But you have to commence the Bachelor of Dental Surgery program from first year and complete the full 5-year degree.
If someone's interested and thinks that they might be interested in oral health or dentistry, again, we would really, really recommend you going and spending time in some dental practices and in a variety of practices, because you might find that some practices will have a dental hygienist, which is different to an oral health therapist. You might see an oral health therapist that's done additional training where they can provide restorative care for adults. So you'll see them use their full scope of practice. If you go and see perhaps where you've been to a school dental service in Australia, if you've been a patient of a school dental service, highly likely you've seen a dental therapist or oral health therapist. So the more practices you visit, the more information you'll have to actually really work out what the right career choice is for you.
Great, thank you. Bit of a relocating to Adelaide question. Are any of our student panelists originally from interstate? Great, this one is going to be for you, Samantha. Did you notice much of a culture change moving to Adelaide, and how did you deal with it?
So I was from New South Wales. So in terms of culture change, well, obviously New South Wales and South Australia is different. One of the things I have noticed about South Australia is it's less busy, I suppose, and the lifestyle is more relaxed. So it's a really great thing for when you're studying, to be honest. So I really enjoyed that. Though obviously, like, it's in terms of university culture, it's not too different. And obviously with our course, we see the same people every day, basically. So you end up quite enjoying those friendships you form within the grade. I'm pretty sure Prithika and Sharon can add more to that because they are from international. So I'm guessing there was probably a bigger culture shock for them.
Yeah, Prithika, would you like to help out with expanding on that?
Yeah. When I first came into Adelaide, I was alone when I first came in because it was just me by myself. But I felt like I became really responsible. Like I learned how to cook and I had to do all the dishes by myself. So it was a really eye-opening experience and it really made me independent, which is good, which is really good. And like Samantha said, Singapore is really like I'm from Singapore. So Singapore is really different from South Australia. Singapore is really busy, while South Australia is a bit more quiet, which is really good for studying as well, because you get more time to study, which is like in dentistry. Although studying is not everything, but you need a bit more time to study as well. So there won't be many events that will like distract you. But at the same time, there are really nice events in South Australia, like the Adelaide Festival, and we have other food festivals as well, which is really nice. And I would say that like coming to interstate is not like, or like moving states is not that difficult if you can form really good friendships so that you won't feel alone and you'll still have a support around as well. Yeah.
Thank you. Sharon, do you have anything else you'd briefly like to add to this one?
Yeah, I pretty much agree with what both Samantha and Pritika said about Adelaide being less busy. And also I think a way that you can help yourself adapt to like a new culture is just by going out, maybe just with new friends and just kind of seeing what there is to offer, because you can never assume too much about a place until you've really experienced it all. So I would say just go out and really try to enjoy your experience, like moving away from home. Yeah.
Excellent.
I would also like to add that we do have a dental society. So that's a really great thing for you to join when you do get here, because you get to meet people who are like you, who have moved from interstate or international, and they're also studying at the same degree as you and from different years. And it's just such a great way that when I first met them, they showed me where to eat, where like I can buy groceries, like just all the like spots in Adelaide. And it's just so great to have that sort of support network. So I would highly recommend you don't need to find them, they'll find you in the first year and then you can join them, and it's just really great.
Thank you. Yeah, just to expand on that, I do highly recommend joining your relevant student organization, regardless of the program you're in. It's a really, really good way to network and meet other people, and other people that typically have the same questions and concerns you might have as well. Definitely look into that. We have many student groups for various degree programs and subdisciplines within the programs. We've got time for a couple more questions. Now, I've got one here about becoming an orthodontist. And this, I guess, will expand on the honours question we had earlier. Dimitra, would you like to help out about postgraduate training pathways?
So once you graduate from the Bachelor of Dental Surgery program, most of our graduates will go on, and work in practice, so whether it's private or public practice, and gain experience. So they actually then can apply their clinical skills and knowledge. And then some, yes, consider like multiple, possible career paths in specialisation. Orthodontics is one of the dental specialties. Others include periodontics or prosthodontics, paediatric dentistry, special needs dentistry, oral maxillofacial surgery. So, lots of the different universities or dental schools will offer a suite of what we call specialty training programs. Our dental school offers, one of them is the orthodontics program, which is the D-Clint Dent program. So usually, like our graduates will have a couple of years of experience, and then yes, it's a competitive application process applying to the D-Clint Dent program in orthodontics. So that will be another additional training of 3 years in what we call a Doctor of Clinical Dentistry, specialising as an orthodontist.
To expand on that, you typically finish your BDS program, your dental surgery bachelor's, gain some work experience, potentially an honours qualification, is quite a good thing to have, considering the type of research skills you'll be building upon in the Doctor of Clinical Dentistry program. Go ahead and complete that in your relevant specialization from there. Yeah. So honours is definitely something that can absolutely help with this if you are considering an honours style year to then look into further specialization down the line. I've got one more question regarding interview practice or interview preparation, I suppose. On this one, what I'd highly recommend, just to begin, is if you look at our admissions guide for the dental surgery program, you will find a kind of overview of the types of themes the interview will revolve around. We don't endorse any specific paid practice sessions or anything like that, but I would really recommend to take a look at the material there and in the admissions guide and work with people to have as much practice as you feel you can gain benefit from. Would any of our students like to expand on that as well? Interview preparation? Sharon.
Yeah, so what I did was, because I didn't really know anyone who applied into dentistry, so what I did was I just Googled sources online for like mock interview questions for both like medicine, dentistry, just any health science program, to kind of like gauge what questions they would ask. But of course, every university is different, and the things they're looking for in potential students is different as well. So I think it's good to have a clear idea of like your strengths and your weaknesses, and also kind of collate a list of things that you have achieved or you have done like throughout your schooling years, and also think about your short-term and like long-term goals, not just in terms of like school and grades, but also kind of personal development. So is there anything that you would like to achieve as well? Yeah.
I'd just like to add to that as well. I think like when they interview, like it's pretty obvious. They just want to see if you like dentistry and if you're suited for it. So I think the best way for you to find that out is actually go to a dental clinic and shadow maybe a dentist for a while, and just ask those questions to yourself, like do I like this? Like what about it do I like? And kind of just, am I suited for this? Like what skills do I have that would kind of fit into this role as a dentist? And obviously like by forming those answers, you should be able to very eloquently and passionately answer those questions in the interview. And I guess the next step is just, I guess, putting those into words and just practicing speaking and just pacing yourself and forming eloquent answers. But at the end of the day, like they're not there to trick you. They just want to see how you feel about dentistry and whether you're a good match.
I'd also like to add on things such as you can practice with your friends. So if you know friends who are applying, it need not be just dentistry. It can be medicine or vet, and then you can just practice with them, and you can ask them like what you can improve on, so that you know where you're lacking as well. And also search up on Adelaide Uni, like why would you like to come just to Adelaide Uni? Like what is so special about the dental school in Adelaide Uni, and why not other unis, and why is it Adelaide? Yeah, that is it. Yeah.
Great, thank you. We are running out of time. I'm just going to grab one or two quick questions. If we don't get to your question in the chat, when we finish the presentation, our support team will still be here able to answer remaining questions that we have. If we can't get to you, you are welcome to contact us via our faculty and future students' email address. Just briefly for remaining questions, how heavy is the workload in the degree? Is there any chance to work part-time while studying? Student perspectives from our third years?
I'll answer that. I actually do work part-time, and I have been working part-time since first year. So I usually can work about 12 hours a week or so. And it's manageable. Like, obviously you've got to keep on top of your work. I do enjoy working part-time while studying because it kind of keeps me organized, and it kind of pushes me to keep on top of things and not leave things last minute. So I would recommend it. I have other friends who obviously are working to support themselves, so they work a lot more hours than I do as well. And I know that with good time management, it's definitely doable. It's just up to you what you prioritize. Like obviously there's been some weeks where I'll have to cut out some social time or some relaxed time because I need to get through the week. but that's just your priorities. So I think it's definitely possible to work. I've been doing it, and I need to, and I plan to keep doing it till I graduate.
Excellent. Thanks very much.
Can I just quickly make a comment on that, Matt?
Please.
Sorry.
Yes, of course.
I think when you are looking for part-time work, you need to be quite clever about what type of part-time work. We don't want to see you get trapped working for somebody that expects you to be flexible with your hours or expects you to miss classes to go to work. So actually to really think about what type of work you could fit around the study and make your expectations or your availability really clear to your employer so that you don't get sort of pressured and trapped later on.
I would just like to add to what Dr. Parker has said. So I personally do private tutoring, and a lot of people in my grade also do private tutoring because the hours are amazing. So it's very flexible, and our degree is quite demanding in terms of the hours we need to be at uni. So that works out really well. And I know a lot of other people in our grade either do dental assisting, and it's also really good because you can work weekends, and usually the dentist is quite understanding that you have to go to uni. And it's good practice as well, so you can see things and also learn on the spot.
Absolutely, that's some great advice. Thank you. We are just out of time now. Just before we finish up, what I'd like to recommend is, if you do have any other questions or would like to chat with the future student team today, send us a question today. We'll get back to you very shortly. You can email us at start@adelaide.edu.au. That's our main email line. You're also welcome to visit our website, call us, request a callback if you prefer. Otherwise, if you've got any technical questions or would like anything else with a kind of longer written response, please do email us. We'll get back to you as soon as we can. Now, also, in terms of events coming up, we do have our open day. It's been confirmed for Sunday, the 14th of August. So the open day will be a really excellent opportunity for you to come along. We are doing a face-to-face and an online open day. The face-to-face will be on the 14th of August. Be a great opportunity to come and meet some of the teaching academics in the programs, as well as some of the students you've met today, very likely, and some other students in our dental program and other programs at the university, and get a chance to kind of have a tour of the campus and everything else. Traditionally, with August open days, please do bring an umbrella. It is typically very wet. Now, that is about everything for this evening. Thank you very much to Dimitra and Eleanor for joining us, providing all that excellent information about the program. And thank you very much to Samantha, Prithika, and Sharon for coming along to provide that really valuable student perspective as well. If you do have any remaining questions in the chat, our support team should be able to get to you shortly. Otherwise, thank you very much for attending, and we hope to hear from you soon. Thank you.